Dementia is everyone's business, and the approach being taken by NHS Gloucestershire Clinical Commissioning Group includes improving early diagnosis, care and community support. Raising awareness and understanding of the condition is central to their innovative approach, extending even into the classroom. Jonathan Gibson reports.
Peter and Sue are living with dementia, but since Peter was diagnosed with Alzheimer's disease, he's found a new lease of life.
I go out to Bishop's Cleeve singing for the brain, and I go down to Wallace House. That's another place that I do the Mind song.
He seems to be doing a lot more now. I mean, obviously that's down to the different organisations that are available.
In Gloucestershire, where the Taylors live, a multidisciplinary team of professionals encourages early diagnosis, so patients and their families can access support as soon as they need it.
Is that important?
Crucial. And I think this is one of the things where I think we thought at first we could manage. And after 5 or 6 weeks, I think it was, I rang the memory clinic and I said, could we talk to our memory nurse? I don't know what we're going to do. I can't carry on like this. And so that was when Alison came.
The earlier the diagnosis comes through, the quicker we can put the services, set the services up and, kind of plan for the future.
In Gloucestershire, we pride ourselves on the fact that we work in collaboration and in partnership. Otherwise, people can fall between services and that leads to poor care and hospital admissions that perhaps are unnecessary. 5 years ago, we were diagnosing about 30% of people we thought had dementia, and we've got up to nearly 65% now.
That's been achieved by bringing healthcare and voluntary services together and working with charities like the Alzheimer's Society.
Once somebody's reached a diagnosis or they are seeking a diagnosis, then our service is in place. What I say to people is that I'm like the yellow pages for dementia. If they don't know the answer, they can call me and hopefully I know somebody that can help.
Managing Memory Together is one of the support services working directly with Peter and Sue. It organises networking events for carers as well as providing information, education and practical advice.
When someone gets referred from their GP, they come through to our service, they will see a memory assessment nurse, get a diagnosis, have a post-diagnostic appointment. And I think people really value the fact that they can talk to a professional in that group setting. But also people learn so much from the other carers at the group.
But as well as linking services together, Gloucestershire is also leading the way in making awareness of dementia everyone's business.
Dementia is not just about losing your memory. There are over 100 different types of dementia.
Newent Community School is working with Forest of Dean District Council to put dementia on the curriculum and encourage pupils to become dementia friends.
Obviously we have an ageing population, so we need to think more about the way that we help the people with dementia in our communities and the way that we can enhance their lives by helping them.
But as well as helping pupils understand a condition which may already be affecting someone they know, they're helping to educate the wider community by tackling the stigma dementia can attract themselves.
We went to a primary school to teach Year 5s about dementia, and we did this whole lesson plan which included games and a bit of role play to try and get the message across to them.
They become really passionate and they're almost like ambassadors. I think they see themselves as actually going out and really spreading the word.
My grandfather, we all loved him very, very much. And it was very painful to see him declining. We didn't all understand what was going on. And in those days, there was a lot of stigma. I'm a doctor, but even for us, when it's your family member, you kind of think about things differently.